are known as someone who can spot a trend. So what is it about healthcare? What is it about Matic that excites you most?
You can change people's lives if you really do make something amazing.
Lord knows we add friction in healthcare.
Interesting.
It would not surprise me if half the day was spent on things that were not specifically about delivering care and adding value to patients' lives.
Either you've lost your physician or your physician is frazzled and burned out. I mean, you don't want to get your hair cut by somebody who's frazzled and burned out, much less your physician. Hey, what can we do? Business 101 things, people, process, technology that can make this better.
Go into that a bit more. Calvin Carter, Dr. Crow, great to be with you today.
You as well.
Good to be here.
So I want to unpack a little bit about your backstory to create some context about Matic and what you really want to do in the world with the organization. So Calvin, you have been at the forefront of technology for more than 35 years, doing amazing things in web, in mobile, and now AI. So where did your passion for technology and building great organizations first come from?
Well, it started way before 35 years ago. I'm 55 now. So at 9 years old, I touched my first computer and it just made sense to me. And like, it got me, I got it. I'm like, ooh, there's something here. This is exciting for me. And I can explain why. But the other component was I'm the son of two entrepreneurs. So both my mom and my dad are entrepreneurs. So I grew up just thinking that it was normal to talk around the dinner table about, P&Ls and, how to make payroll and how to finance a business and how to deal with recruitment and retention and delivering value to clients, et cetera, et cetera. So I grew up, wanting to build a business as you want to step into your parents' footsteps, right? But also obviously around technology. Technology, very exciting because it feels like a superpower. When you can really use it right, technology does give you superpowers. It allows you to do things that you simply were not able to do before. And doing things in the digital world starts to, it releases you from so many other burdens, and you can make things quickly and make things that can be very powerful in people's lives. And so that combination of entrepreneurialism, technology is kind of what drove me the whole time.
And you're around it very early on.
Yeah.
And I remember one of your first businesses, I think, was like a dating website or something like that. Is that
Thanks
right?
for bringing that up.
Yeah.
It was embarrassingly called the Appleman Love Connection.
There you go.
And it was, I think I was 11 or 12 at the time,
Mm-hmm.
Probably didn't even, I was obviously not dating at 11 or 12, but I saw a need in the market. And this is before like the web. And so this was dial-up bulletin boards. And so dial-up bulletin boards, you dial into the Appleman Love Connection and you'd fill in a report or, a feedback form about who you were, and you'd log off. Then the next person would log in. I had one phone line, went into the computer in my bedroom. And so I could serve one customer at a time. I also learned a lot about revenue models. Lifetime membership is not a good idea. So I charged $3 for lifetime membership to the Appleman Love Connection. But I also learned very early, you need to have good checks, because I actually got a bounced $3 check. I keep it to this day to remind me to always be vigilant and somewhat paranoid. I have an NSF, insufficient funds check on my desk for $3 made out to Appleman.
That is an awesome
was me.
story.
You got any stories where the connection actually stuck? You have somebody that's now married.
Yeah, married, has
50
kids.
years.
Whose life did you change, Calvin?
Well, I don't know their screen names. I'm not even sure it's appropriate to say their screen names.
Okay.
All right.
Wow. So what would you say was your first entrepreneurial success that, this was no longer a hobby, this was something that really turned into something?
Well, I think probably when, through my whole life and also in college, I had lots of odd jobs, in the technology space. I call it beer money, just to kind of, get things, mercenary programmer, et cetera, et cetera. But I think when a company basically hired me at a very young age to completely redesign all of their systems, both network, software, et cetera, and they were like, wow, our business has never run this well before. We've never had this ability to do it, X, Y, Z, whatever. that's when I really was like, oh, wow. So you can change people's lives if you really do make something amazing. So that way, it was just it was a small, I think, independently owned marketing agency, and I helped them level up using technology that was like a mystery to them before, and then became a superpower for them as well, not just me.
Wow. So let's talk about Bottle Rocket after your incredible success with Bottle Rocket that everyone here knows about. Like, why did you set your eyes on healthcare and specifically Matic? And the reason why that's an important question is because you are known as someone who can spot a trend, be there in terms of perfect timing because of the way that your mind processes the world. So, what is it about healthcare? What is it about Matic that excites you most?
So I would point to it was almost, for me, it's like, how could I not? For me, it was just like the next thing in a trend of my life. So I am very much focused on finding systems that have friction in them and then removing those systems and empowering the stakeholders of those systems to lead better lives and achieve more, create more value and achieve more within their day. So whether that be a consumer oriented project, but let's say Chick-fil-A or NPR or Southwest Airlines or whatnot, or healthcare, it's really the same. It's identifying those friction points, really empathizing and embracing the stakeholders and working on behalf of the stakeholders by becoming those stakeholders and walking in their shoes, and then essentially unlocking things, leveraging technology. So I don't really start with the technology. It becomes more of like that last mile, but there's many miles walked of really understanding and figuring out how you can add value. And let's be honest, I mean, healthcare has a lot of opportunity and has a lot of friction. So it's ripe for that. However, the thing that really got me in is Dr. Alex Shepard, the founder. And so when I first met Alex, and Alex and I were working for a few years on some kind of side projects, algorithmic trading. He had built options equity trading systems for Wall Street, still used today, powerful systems. And I learned one day, and this is a guy who's got an MBA, he was pursuing and then received his PhD in AI. And then he told me that he was going to medical school. And I was like, what? You're going to medical school? You're probably the most gifted engineer I've met in my life, and you're going to medical school. Why? And he goes, because I want to change healthcare from the inside out. I was like, wow, we're going to get along really well, because I do everything from the inside out as well. And so much respect to someone who is going to go through such a major investment of their life to really build credibility and subject matter expertise to really rebuild something from the inside out. And then he told me about how he had invented this ambient scribe. And I was like, well, that sounds pretty cool. And he showed it to me. This is way before all the ambient scribes that are available now, way before. And he showed it to me, and I was like, this is great, but I bet this is just like one day this will just be a feature. But when he told me, when it really finally dawned on me that what he had built was a system that captured the full immutable record of truth between caregiver and physician, caregiver and patient, then I was like, oh, wait, hold on a second. What else could this lead to? And what we all know about healthcare is there is a very large amount of time and money spent on correcting errors downstream from that interaction between caregiver and patient. And so, as any good engineer would, they would say, great, how do we prevent the errors versus correct them? So we sat down and we said, gosh, with that record of truth, there's so many things we could do. And then I got really excited. I actually felt empowered that the work that we're doing really could make a pretty material dent in healthcare, because it does seem like an unscalable mountain, almost like not worth trying. Like, why bother? That kind of thing. And I think the combination of where we are with technology and AI, where healthcare is, and where Alex and I were, like, in that desire to really put those things together and start at the point where we started, that's what got me really excited. And I was like, this is guaranteed to make a major impact because we're entering it the right time and the right place.
Interesting. So it's kind of a combination of sort of meeting a young superstar who
Yeah.
had these unique insights.
Yeah.
And then the more you delved into it, the more you saw this can help a lot of different people.
Yeah.
Right.
One of the cool things about Alex is because he's coming into medicine, he is not complicit with decades of current state
Yeah.
of how physicians have practiced. So he's coming in very, asking questions, but also having enormous capabilities. So that's really powerful to approach something, a very, very fresh idea. How we always like to build things is imagine and envision a future state, like an envisioned future state, not what's going on today, but what wouldn't it be great if? So you really design and you build and you describe that. You figure all that out, this imaginated, future state. And then you say, okay, well, what's the difference between where I am now in the envisioned future state and where, I will be in the real world if I step back into the the current state. And then you and analyze the gap, and you basically build a bridge between the two. And then you get to work actually bringing that bridge to life. But you have to stay future focused. It's hard to stay future focused if you're overly complicit in something for a long time. You have to kind of come in from the outside, but then not just like say, oh, you guys are all doing it wrong, I know how to do it. No, that's a horrible idea. You don't do that. You embed yourself. It's a whole forward deployed engineers, that sort of modern approach now that works really well. We use it. You embed yourself, and you're able to then learn about the current state, but then hold that envisioned future state at the same time, and make the connective tissue between it. And because he was coming in, he had a lot of great ideas about how he himself would see this patient differently, or walk the halls differently, or do this differently or that differently, because he was both engineer as well as physician.
And what an interesting pairing. And you're kind of like the perfect insight to help spot that thing and then turn it into something greater.
Yeah.
So we're going to switch gears here to Dr. Crow here in a bit, but there is something I wanted to ask you, Calvin.
Okay.
So oftentimes whenever founders exit from their company, they kind of go through like an identity crisis. Like, what do I do now? What's my mission? What's my purpose? And just knowing you through that transition, you were trying a bunch of different things. So my question is, what was that experience like for you? And what did you learn about yourself?
That's a podcast on its own, man. But I'll give you a couple highlights.
Okay.
First one is, it's very true. Your identity as an entrepreneur and a founder, you don't really know where you end and the business begins, and who cares really where it separates, and until one day you're not at it anymore. And so what I did was just focus on the things that I love to do, and Bottle Rocket was an expression of that. And my life's purpose is to build beautiful things I love. And so for me, I got back to building. Whether it was that algorithmic trading system that gave me the opportunity to meet Alex, or transitioning into Matic and growing Matic, I like to build, and those things need to be beautiful. And beauty isn't just how something looks, it's how something feels and how something works. And the thing that I'm building has to be important to me. I have to love it. Remember, that's part of my purpose statement. And so, by doing the work that I'm doing now, I'm loving unlocking things for people. And the great thing about healthcare is we can all identify with it. None of us are, outside of that. We are all a patient. All of us are. And so it's interesting because all humans would come with a built-in desire for what that future state would be. So for me, the riffing on the future state was just like me thinking about my own life and my kid's life and my wife's life and my mom's life and things like that. And so that future state was like, bam. And then it came to the hard work of building.
Wow. And how exciting is it that your brain is now tackling this issue for the world? And that is super, super cool. So, Dr. Crow,
Yeah,
you are, of
with
course-
another superpower
yeah,
person next to him. I mean, that's
With
what's-
Alex.
Alex.
Yeah.
Okay.
Yeah, that's what's
I
different.
thought you were
about-
referring to yourself. I was like,
Oh, no.
That's an
No,
awesome
no.
humble brag. Okay, yeah.
No, not me, Alex.
Yeah.
Like you don't have many founder stories
Yeah.
like this.
Yeah.
I mean, I'd called him Batman and Robin before, but that's that's insulting to Alex because Robin. I mean, he was no Batman.
It was Batman and Batman.
It's even. I'm trying to find the right analogy that is approachable, digestible for a community to understand. But I kind of started with the Star Wars analogy of kind of like an Obi-Wan and a Luke Skywalker coming to bear. But it's really, you got to go all the way a little bit deeper into the Star Wars series. It's really almost like Luke Skywalker kind of coming back and teaching young Rey, who's got these ridiculous powers.
Yeah.
Ridiculous
Stronger
powers that's stronger than Luke's, but just doesn't know how to even bring them to bear.
Wow.
And this guy comes back for kind of one more round of a new world order to try to bring something to life that wouldn't be otherwise. That's the 1-2 punch these guys have. That's very different than two guys that went to college together. I mean, a generational difference with a out of this world new technology. That's a different story, and it's one of the reasons. I mean, we all have to choose each other, right? But obviously, it's one of the things that really attracted me to them is all the purpose-driven things that Calvin speaks to is right on brand with me, and having someone that's young and naive and ferocious in their capacity is exciting. There's lots of stories of young entrepreneurs in their 20s that burn out and lose because they're not wise enough yet. They're capable, but they're not wise yet. So you combine some wiseness with some capabilities, but also these newer capabilities. It's really exciting to think what this could unlock, because Lord knows if we're talking about trying to remove friction, we add friction in healthcare. We have not subtracted friction in my entire career. We've only added friction.
Interesting. Okay. A lot of interesting things here. First off, does he know about your love with Star Wars before mentioning that whole Obi-Wan thing? Or did you prep him for that?
I'm kind of a Star Wars nerd.
Yeah, that's why I thought the description, the metaphor was,
I didn't know that.
I'm a big Star
I was trying
Wars
to think
nerd.
of something that makes a lot of sense. And so
I was
that
like, that's the perfect analogy for Calvin
There
and
may
this
be
guy,
pictures
Alex.
of me in screen accurate Star Wars costumes somewhere on the internet that I may have made.
Oh, man. I know there's plenty of those. So, okay, interesting. So, well, actually, let me ask you this then. So we've learned a little bit about Alex's kind of superpower, but you being the healthcare part of this, what do you think Calvin's superpower is from your perspective in healthcare?
So he said it a minute ago, is like, I don't build technology for use cases that then I just take out. I actually try to go understand the problem. Where's the friction? How does it work? And how do I relieve that friction with a forward-thinking, future-thinking, what could be, and then technology is the enabler of that. And so this, co-developing with the client or the customer in the whatever industry he did, whether that was ticket sales or airlines or fast food or TV channels. I mean, he always went in and did one that way, and then it could extrapolate to others. So we're not here to fix catalyst per se. We're here to how do we literally fix primary care the same way he revolutionized online ticket sales or fast casual ordering and such. So that's what he brings. That it's a philosophy. It's a philosophy of how good work is done, and then he's teaching the young superpower that has skills that, like he said, is a very big statement for him to say about Alex that it's the best engineer I've ever seen. I mean, he's 55.
Yeah.
He's hired hundreds of engineers in his career over multiple decades, and this is number one. And he's living inside a healthcare ecosystem right now, learning 24/7. Combined with him, it's super powerful. So that's an example of discernment and spotting opportunity and talent, is just to be able to make that connection to his co-founder.
Wow. Okay. A lot of things there. One of the big things I heard also was his approach to developing
Well, that's the number
a
one.
solution, right? It's not a cookie cutter product. It's really embedding yourself with the user, caring about the user and designing around their needs. And I was going to ask you, Calvin, what did you bring from Bottle Rocket? But I think that certainly could be part of it, right? Because you always taught us to have empathy for the user.
Yeah.
Right?
Yeah.
What's the
Serve the
problem? How do
user
you
was one
embed
of our core
and design?
values.
Exactly, right? So
Mhm.
that makes total sense. So,
Mhm.
Dr. Crow, we got off track there. So you, of course, are a great physician leader, but this incredible organization in Catalyst. So give us a bit about your origin story. What first inspired you to become a physician?
You know, it's funny. I hadn't been using the words friction until I got around him. But
Mm-hmm.
you know, I grew up in a small town, and I think this is probably true for all of us. You really have dreams and aspirations of what you could be based on what you grow up seeing. And in a little small town, the the most impressive and highest character and integrity role that was being played in my community was the family physician. They were the mayor, head of the city council, head of the school board, head of the Presbyterian, Methodist, and Baptist churches. They spread themselves out across those, and that's what I saw them do everywhere. Not just when I went to get my shots or when I had a strep throat. You know, they were in the community, elevating the community. And so, if you're a young child dreaming of what you want to be when you grow up, and you kind of look and you're able to think about, I want to be respected, I want to do something that does good in the world, and I'm thankful that was put into my heart and soul by my parents, then that was just naturally where I went to. And so I went to college with the idea of going to medical school to be a family physician. And that was just that was it. But once I became one, so I did that, accomplished that. Once I became one, I started to kind of channel some of those earlier years and really saying, what were those family physicians really doing? Because I'm seeing patients here, but I remember they were actually more than that. And so I had like a lot of us may have, or at least the movies like to think that we do, you know, a Jerry Maguire moment probably 16, 17 years ago, where I just began really channeling that younger me that was watching what those primary care family physicians had been doing, and then really me challenging myself is to like, hey, what are you doing here? Like, why did you really become a family physician? Is it just to see patients all day? Which, by the way, 99% of family physicians are doing, and I think that's great, but it felt like I was being called for more. And so that's where I started to try to unlock maybe, you know, I'm supposed to be here to help our communities thrive by making primary care more accessible, more convenient, more impactful for the communities that they're in, because they play such an important role in people's life over time, different than any other type of physician. You know, there's life-saving physicians here, and there's, you know, surgery physicians there, but really no one else over a long lifetime, multiple decades, can have the type of impact that a primary care physician have. Study after study worldwide, you live longer, you cost less, and you have more good days than bad if you have a longitudinal relationship with a primary care physician. So I really felt called to, and that's what I've been doing for the last 16, 17 years, and will continue to probably until I'm pulled off the earth, is how do we make it better? And in a world where, going back to his word of friction, regulatory friction, technology friction, financial friction, consumer preference friction is just adding and adding and adding on top of the primary care physician right now in ways that we're sub-optimized, and that's inconsistent with what I'm trying to do every day.
So it sounds like you were driven to serve more, to do more, right? So what were the early days like? What was the MVP, the minimal viable product of Catalyst before it became the thing that it is today? Did it go through iterations? Like,
Oh,
what did those
sure.
early days look like?
Oh yeah, we talk about S curves of redefining yourself over and over, and we've probably been through. It depends on how you think about it, but 7 or 8 since 2001 when I got out. So I saw patients all day, every day for the first 12 years when I got out of a residency. I slowly got into more leadership, administration, leading my group, growing my group. But those early days, I was not only the physician. My original partner and I, when there were not patients in my exam room, I was running the front desk. I was checking people in and out. I was doing the nursing. I was at the end of the day doing the billing. For the first 5 years of practice, at least, I was in charge of opening. Back then, things weren't electronic. Like the mail had your checks in it from the insurance companies, and so I would look at all of them. Usually, people would have a billing company. Well, I put myself there because I wanted to understand the end to end of the pain and the friction that's inside the system, so I could know where all the points were that we could begin to tackle that. And then we began to tackle that. and over time, with technology, first electronic medical records, which solves some problems, but then creates new ones that many are familiar with, through business 101 processes. I didn't fail to mention I went to get an executive MBA because I didn't want to be that physician that had the stereotype of being the bad business person. And so I went to get an executive MBA, not with physicians. I wanted to make sure I wasn't doing it with any physicians. I wanted to understand what other challenges, what other frictions people were having in other industries, and how I could think about that as an analog from an identification, but also a solutioning of, people, talent, organizational design, all the things. It doesn't really matter what your business is, that we all, as leaders that are trying to build great companies, struggle with its own friction. And so that gave me a language and concepts that would allow me to then apply kind of business 101 principles to healthcare, which most independent practices across the country weren't doing, which is one of the reasons why healthcare has gotten so corporatized, because physicians aren't taught that in medical school and residency. And so as friction gets into a system and you don't have the ability to innovate and systematize things, your business model begins to fail. And in America, there's corporate, whether it's the hospitals or insurance companies or private equity, are happy to jump on that and use their business 101 techniques for their own good and their own financial. And I didn't want to see that happen to us.
Interesting. So you started by fixing your own problem and eventually developing a kind of method to be able to serve others. It's really interesting. My limited insight in healthcare, I have spoken with some very credible healthcare leaders. And one of the things that they described to me, which I didn't know, is they said that most doctors, more physicians, are less business people and more like an artist. Like they care about the diagnosis, they care about the care, but all the other stuff, the ancillary stuff, is not like their strength. But like that seems to have been kind of like you're like both, right? So I think that's really interesting.
Yeah, I certainly speak both languages, and they
Yeah.
are two distinct languages. Unfortunately, I don't know how. It's interesting. Do the physicians, are they more artists? Yeah, maybe. Unfortunately, a lot of physicians, because the way we grew up building doctors in America, were like knowledge based. Like the more knowledge you could take on, the better you were, and so you got really well known for how smart you were, right? Where a lot of physicians made the mistake is they thought that elevation of their intellect in that category would extrapolate to other things like business. And so you trick yourself into thinking, well, if I'm smart here, I'm smart everywhere. And that's been our downfall, is the way I have surmised the consolidation and the corporatization of healthcare, is because we actually didn't have that extrapolating knowledge. I went and tried to learn it and then practice it. And like any good thing that you practice, you begin to get some skills with it. But it was no different than having to go to medical school and residency to get those skills. It's a different set of skills and a different jargon and concept altogether. The question is, can you marry those together? And in my world, for helping communities thrive.
Wow. And you figured something out because of all the things that you've done with Catalyst. So that is an amazing story and how all that fits together. So let's talk about now the challenge and the solution that Matic offers. And Calvin, I'll toss this over to you. So as an outsider coming in to healthcare, what surprised you the most about how physicians spend their day?
Well, the amount of time that is non-clinical, or the amount of time that's not with a patient, caring for a patient, um, or being able to add value to a patient. So, for example, uh, with Matic, we save physicians at least 90 minutes a day of just gathering the information necessary to do appropriate chart prep, which is essentially the preparation process if you want to be truly prepared and if you want to really get all the information together about a patient you're about to see, so the time you have in the room with them is both very effective, but also you can be proactive with them as well versus just reacting to whatever ailment that they're self-reporting. So that's 90 minutes that they're not actually caring or even doing anything other than collecting paper and clicking through screens and trying to find the right information. And that's just one of dozens of examples of the things that they're having to do. Other ones would be spending an enormous amount of time in their inbox. It's like how you have an email inbox. You don't respond to your emails, no big deal. Doctors need to respond to their emails, so to speak. I mean, they have refill requests. They have, serious things. They have people waiting on them, whether it's an MA or whether or not it's a patient who needs to know something. And so there's a huge amount of administrative burden on these doctors. And so I didn't really ever take enough time to maybe put into percentages, but it would not surprise me if half the day was spent on things that were not specifically about delivering care and adding value to patients' lives. And the reality is that, physicians are all purpose driven. Everyone is purpose driven, and they have a desire to help others. They have a desire to use their capabilities and the knowledge they have and the techniques that they understand and their special gift to the world to help people feel better and live longer and have better days, and et cetera, et cetera. Yet so much of their time is not spent on that. And I think the world just kind of eventually just kind of said, well, that's how it has to be. That's how it has to be. Healthcare is always going to be complex. Healthcare is always going to be hard. There's always been an administrative burden. But the reality is it's gotten worse, it's gotten worse, and it's gotten worse. And we all know that. But then when you go into it and you're sitting with these people and you're seeing their brow and you're reading their body language as they're going through their day, and as the many, many, many hours that they're spending off gift, outside of their purpose, it really starts to kind of get to you. And I was like, man, this is not okay. These people are unbelievably talented, very smart, very driven, very purposeful. Yet we are holding them back with so much stuff that's super artificial.
50% of the day can be dedicated to
I
admin.
guarantee you there's studies, but that's how it felt.
So, Dr. Crow, when you were running your own practice, does that stat feel true? And if so, what were some of the things how did you feel about it? What were some of the negative outcomes as a result of it? Go into that a bit more.
Yeah. And more so now than ever. I haven't seen patients in over a decade, but all the things that have been added, regulatory and technological, and really just patient expectations with the world of mobile and social media, it's only stacked. So, and the end result is you hear about this physician burnout, and you see about a retreat of physicians either retiring early or building these direct primary care practices where they're only going to take care of 300 or 400 people. And so that has an effect on patient care. Either you've lost your physician or your physician is frazzled and burned out. I mean, do you really you don't want to get your hair cut by somebody who's frazzled and burned out, much less your physician, be that person. But that's the system, to Calvin's point, that it's just kind of evolved into, that's just the way it is, even though, primary care physicians have been sounding the alarm bell for forever, and all the mega trends of the corporatization of it and the retraction of primary care physicians from retirement early or moving to a different model, or even most importantly is there's not a big wave of new primary care physicians being made, because is that really what you want to do anymore, the way I wanted to do that in my small town growing up? Does it look as good as it used to? And the The answer is no. And so, you know, the way I went about it back then and continue every day is to say, hey, what can we do? Business 101 things, people, process, technology that can make this better, And so we've been after that this entire time. One of the biggest things I think we've done, and it's one of the two things that are going to create this better future, is the world of healthcare is financed in America through episodes or transactions. I went to the emergency room, I got hospitalized, I had a knee surgery, I had a procedure done, I had a CT scan done, I went to the primary care physician's office for an appointment. And so everything is like transaction based, and that works almost everywhere else in healthcare probably, except for primary care. We've said it twice already in this first few minutes, is the value of primary care is over time, but the payment model is at a transaction versus over time. So what's really changed with the government and this thing called value-based care that's been bastardized a little bit, but the idea being that you ultimately could pay for the outcomes, the healthier population gets rewarded financially versus how many interactions can I have, which has nothing to do with how healthy somebody is. And so the government's done a good job of bringing in this opportunity to take a longitudinal approach, because they have those beneficiaries for the rest of their life, so they can have a longer term view, and they can attach a financing model to it that's a longer term view. However, still the majority of primary care are still in this fee for moment type of 10 by 10 exam box that requires you to be at the same time at the same place to have care be delivered, which when you unlock that, the potential is exponentially different. And we're seeing that a little bit on the Medicare side. And so as you combine that, which is now starting to show up in the employers thinking about primary care differently than just a transaction but a subscription, with this technology that's transformative in it's Star Wars technology to be able to do the things that it could potentially do to keep physicians from being knowledge workers and information gatherers and box checkers, like all the stuff that's the plus 50% that we hate, into being empathetic, being able to judge context, integrate a lot of human type of moments versus knowledge type of moments, building trust. That's where care delivery really becomes much more impactful for our country, and unlocking the physician from time of information gathering to be able to focus their attention on the patient is the shift that, along with the financing model and this technology, is our way home.
Yeah. Yeah, the recurring thing that I keep hearing is that the biggest thing it's going to give the physician back is time. And there's so many things that you can do with time. You can see more patients. You can improve the quality of that encounter. You can spend more time with your family. So there's like all sorts of great outcomes for the physician, for the patient, for the practice, as you mentioned. So let's get into it then. Calvin, what is Matic?
So Matic, again, being a believer in serving all the stakeholders together, Matic first is interested in the stakeholders, and we have three stakeholders. One is physicians, practices, and patients. We call them the 3 Ps. And we have to serve all three together. So this is not just a collection of tools that, let's say, a physician would use to take their existing way of practicing medicine and just maybe shave a few minutes off here or there. Things like ambient scribes, they do that sort of thing, and they're great, but they're just point solutions. So what Matic really is, it's a full ecosystem. It's a collection of 3 platforms, one for the physician, one for the practice, one for the patient, all interconnected. But we did learn that when you serve the stakeholder called physician, you end up creating untold value for the other 2 stakeholders at the same time. We give physicians superpowers, and we take everything else out of their way so they can give the best care of their lives. It results in patients getting better care, being seen, heard, valued, and cared for better. And obviously practices, have much better economic outcomes from that as well, because essentially the physician's performance is going to be rolled up into the practice's performance in any practice run like a business. And so it's a set of technology that you lay on top of your existing EHR, so you don't have to re-platform, for example. And I'll take you through the physician one just because it's kind of probably pretty straightforward to understand that. So a physician, I mentioned before, usually they start their day very early. They do an enormous amount of chart prep. We take care of all of that for them. We're not just looking at information that's in the EHR. We're going to third-party data sources, like, for example, Catalyst is partnered with Agilon, which provides a lot of really great information about suspected care gaps and suspected codes that need to be closed, and also quality gaps, chronic issues, et cetera. We bring all that in. We bring all the information in from the various specialists that primary care person may have referred out to. So we bring all of that information in, obviously the vitals and everything else. Also, the latest and greatest understanding of standard of care. And then we put together their entire encounter. We reconcile everything inside any redundancy, which is tons inside the EHR, reconciling problem lists, identifying which problems need to be on the list, which problems probably shouldn't be on the list anymore, merging redundant issues to really give the physician a very clear, very comprehensive understanding so they can be not just address the issue of why the person came in, but they can be very proactive. They can start the conversation and say, hey, you know what, there's a couple of things here I want to check out. You don't want to be diagnosed in the hospital. You don't want to be diagnosed when it's essentially a major problem. You want your primary care physician to be able to help you be proactive. And so that's one thing it does. Of course, it's going to do everything that you'd want it to do in terms of ambient scribe and taking unbelievably comprehensive notes. I mean, better than anything I've seen in other systems. And it's going to be doing all of the coding. It's all the order creation. It goes through and does all the CDI, and so it helps a physician. Because remember, physicians they didn't go to school to learn how to do insurance coding. They went to school to learn how to, help people, live longer and have healthier lives. Yet we're expecting them to remember 70,000 codes and wield them with great expertise, and then punish them when they don't, which is ridiculous. So we take that burden off of them as well. We ask them some clarifying questions if we, to help perfect, the various things that we're doing. I mentioned before about all the error correction that really bothered me. Everything I've listed out so far is all about error prevention. It's all about getting it right the first time. The diagnosis right, the comprehensive, and the number of diagnoses that you would need to have, the documentation correct, the coding correct. Everything is set up within that encounter, whether it's a 10-minute or hour, whatever it is, it doesn't matter. We're preventing the errors so they don't have to be corrected later. And then we also help the practice and the physicians think about their entire panel, not just, who am I going to see in the next 15 minutes and being ready for them and trying to do best I can with them, but also looking across the entire panel and identifying who are the 5 to 10% of the people who, how can we identify them? Can we bring them in? Get proactive with them. Have they not been in a while? Do they have a high probability of, let's say, COPD, yet they have not been diagnosed for it? And it's better to diagnose it proactively than reactively. We do all of that work as well. And then also we handle the connection to the patient. We're putting apps in the patient's hands so they can have both get a convenience of healthcare and also accessibility. Example of convenience would be, I don't have time to come into the to come in and leave work. So can I get a televisit just in the palm of my hand? Can I talk to an AI to see whether or not there's something that is meaningful? Can I even just ask, to kind of take some accountability for my own care and say, hey, how long has it been since I've had a colonoscopy? And when was that? And what was the advice I was given about that? All of that type of stuff is possible. And so we're putting those things in the patient's hands as well. And so when you kind of step back and look at it, it's just one big flywheel. We're helping to identify issues with patients, or if a patient identifies something, how do we give them care? We're helping the physicians to prepare for and give the best care that they possibly can. And we're helping practices support that in what I call the portfolio model, a multiple lives model, where they're looking across their entire panel across, could be tens of thousands or hundreds of thousands of lives. It's a full system, a complete solution that does not require replatforming, that is essentially giving each stakeholder what they want in that moment. And when you do that, you end up serving all three stakeholders at the same time. It's a true solution, and it drives radically positive outcomes for everyone.
I think it's really awesome that you found out that the physician was the choke point and you're designing the solution around them.
Absolutely. Many times it's the patient.
Yeah.
This is the interesting thing. A lot of times, like, for example, like user experience, UX, PX is usually patient experience. We learned that we had to create a new PX, and that's the three Ps: physician, practice, and patient. Matic's new PX is serving all three simultaneously. And then the unlock was that the physician unlocked the value to the other two. That is super powerful, and that is just not the way people have approached this problem before.
Wow. So I want to be respectful of your time. We're almost out of time. We got about 3 minutes left together, but I do want to for sure get Dr. Crow's perspective on this, because you are the customer. Not only are you the customer, you've solved so much of this type of admin burden for other organizations. So what is your message to physicians who are skeptical about AI? Because I know you get pitched all sorts of AI solutions, and now here you are being kind of a co-creator of it, making sure that this thing works. What's your message to physicians who are skeptical about AI, and particularly Matic?
Well, I think physicians have every reason to be skeptical, because they've had a career of technology being placed on them as another friction point, rather than something that actually relieves friction. So that mindset change actually will take a little bit of time. I think as it relates to Matic, what they will learn quickly after, if they're willing to listen to the next sentence almost, because the first sentence is going to be, I've heard this story before, and it ended up adding friction to me. But the philosophy that Calvin talked about of co-developing by living inside the organization and understanding the pain points and their ability to quickly talk to those pain points and connect. I mean, you begin to connect with the physicians when you can tell them their own pain points and they're nodding their heads like this, say, yes, we've been building something with fellow physicians like you with those pain points for you. Not something that, hey, we've built that we think you can use. It's like, no, we've looked at what's uniquely hard and what's been really hard, and how can we take that away. And we understand that the thing you want most is to be a care delivery agent in the world of healthcare to your patients. And we know you want to give all your attention to the judgment and the nuance and the context that's unique about the patient, and that information is now not something you're having to remember everything. It's just being brought to you, and it's a partner to you to help you take better care of your patients. And so you have to get past the first skepticism, stay in it long enough. They're finding AI in different parts of their life. And with Matic specifically, again, I think the founder story and the track record and how they developed everything in Bottle Rocket, connected to the new founder with Alex, it's in healthcare uniquely. This is the type of company that you really want to engage with. That has a again, not two young whippersnappers. You got somebody who has the wiseness and the track record of building where your friction is and removing it. So I'm just real excited for physicians, once they get past that first paranoia, to be able to understand what's different about this versus the emails, phone calls, knocks on doors they're getting that says, hey, I got a solution for you, versus their approach, which is, hey, tell me where it hurts, and let me show you what maybe I can do to help that.
Love that. Calvin, final words, address the skepticism, tell our viewers how they might be able to test it, and anything else you want to share about Matic.
Yeah, sure. I've just came to my mind as you were talking about this is you're right. There's so many stories of physicians that have been trying various AI tools, and I almost wish that I could find each one of them before they got into whatever little AI bit solution that they single source solution, point solution that they had, and help them like pick their second AI first, if you would. I think it's important for physicians to be skeptical, not just because of AI, but they've been sold solution after solution for decades that have really never been designed, to achieve the same goals that they were trying to achieve. Matic is 100% focused on trying to achieve the goals that the physician has and has always had. The other thing I'd say is that, AI is not AI. Just because you have an AI tool doesn't mean you have the smartest tool. There are some pretty stark differences between like good AI and the best AI. And it's not always based on what model you're using. It's how you use that model, the harness you build, the reasoning, the adversarial training, all of the different stuff that you build on top of it. So part of our advantage is a technology advantage. But a lot of it is that empathy advantage. A lot of that is that a physician's going to sit down, and it is, I'm not kidding you, we have story after story after story of someone saying, you know what, I tried AI tools, I've got one, it's okay, I don't need anything else. And within a day, at the max a week, they're saying, I'm never going to go back. This is fantastic. We've got, you've got some physicians that were considering retiring at the end of, I guess, this year, and they've decided to tag on some time because, giving care is fun again. We're returning joy to the lives of physicians. Joy is not just a throwaway word that I just used. It's a very powerful word because joy drives engagement and adoption. And engagement and adoption drive true performance and success of anything. The best of anything you have is the one you use all the time, because it's obviously adding value to you. You wouldn't use it all the time. So these doctors are saying, I don't ever want to practice, the way I used to practice. This is the way I want to practice. I'm being a better caregiver. I've got more time, so I've got margin. I can reinvest that margin. Some reinvested in more patient visits. You don't have to do that, but some voluntarily do that. One of your doctors is seeing 4 more patients a day because they want to. That's a big economic difference, by the way, for patients a day. And the fact is, they're not spending more time. They're probably still, even in aggregate, spending less time overall. We've seen revenue lift through reduced revenue leakage. We obviously see an enormous amount of time saved. We see, both temporal and financial outcomes that physicians are just like sometimes some of them can't even believe it. When you stitch all of these things together, you don't get what I'm describing, by the way, when you get a solution to a thing, like a tool that does research for you, or a tool that does chart prep for you, or a tool that does ambient scribe for you. You don't even get it if you bought 5 or 6 tools and stuck them together. You don't get that. You get it when it is a comprehensive, purpose-built system that is literally designed by individuals who felt the same pain that you felt with, that you feel. They sat next to you and they witnessed, your frustration, and then they leveraged technology and just new ideas, future state versus current state, to come up with new ways of doing what you've been trying to do this whole time. So that's what's really powerful. That's what sets Matic apart. It really is set apart, but the reality is it's hard to stand out in a crowded AI marketplace. It's really hard to stand out in a crowded AI marketplace. I just wish that the right physicians that have this mindset for true change, and they want to run their business like a business, and they want to generate margin so they can reinvest in themselves, whether it's in their business or more time with their family, et cetera. I just would love for them to reach out. It's super easy. We get on a call with you. We show you a demo. It's pretty fast. We ask you questions. Before we do the demo, we ask you questions about your practice. Because remember, we're not there to sell you something. We're there to learn what you need and then help curate a solution for you. So it's pretty painless. Go to the website, matiginside.ai. and you click on the contact us now and we start a conversation.
Awesome. Well, I think you all are a tremendous team doing incredible things, and I can't wait to see all of your future success. So close us out one more time with website, your social handles. How do people learn more about Matic and connect with you both on social?
So in social, I pretty much just post my astrophotography photos.
That's right.
That's
Yeah.
one of my nerdy hobbies. But really, if you want to learn more about Matic, just matikinside.ai.
Okay.
Yeah.
Awesome. Dr. Crow, how about you? Are you
I'm not a big social media guy. I'm on LinkedIn,
Okay.
certainly Catalyst Health Group, and all of the ecosystem businesses we have that roll into that are on LinkedIn and websites that are easily able to connect with us.
Sounds good. Gentlemen, thank you for the conversation today.
Thanks. Appreciate
Thank
it.
you.